Hi, before I start this video, I wish to inform you that much of the research for this video came from GSK funded sources. For reference information, please find the descriptions below. Now to resume our regularly scheduled programming. In this video, I will be sharing an example of a pharmaceutical company which made efforts to introduce branded medications in Africa. Non-communicable diseases, or NCDs, like cancer, are the leading cause of death worldwide, responsible for 63% of all deaths, with 80% of the world's global burden occurring in low and middle-income countries. However, in Africa, these silent killers are projected to increase dramatically, surpassing deaths from infectious diseases by 2030. In response, global healthcare giants like GlaxoSmithKline or GSK had stepped up to address these looming crises. Today we're going to delve into GSK's ambitious initiative to tackle NCDs in Africa, exploring their challenges and what finally became of this initiative. Where do we start? Well, in 2012, the World Health Assembly set a bold target to reduce avoidable mortality from non-communicable diseases by 25% by the year 2025. This commitment, known as 25 by 25 goal, was a call to action for countries worldwide. For Africa, where the burden of non-communicable diseases like diabetes, cardiovascular diseases, and cancer is rapidly increasing, this goal is particularly urgent. Factors like increasing lifespans due to improved treatment of infectious diseases, urbanization, and lifestyle changes contribute to the rise of non-communicable diseases in Africa. For example, the number of people living with diabetes in Africa is projected to double from 12 million in 2010 to 24 million in 2030. This rising tide of non-communicable diseases poses a significant challenge to already strained healthcare systems. GSK is a global healthcare company at the forefront of efforts to combat non-communicable diseases in Africa. Recognizing the need for a multifaceted approach, GSK had launched several innovative initiatives aimed at addressing the unique challenges of non-communicable diseases on the continent. One of the cornerstones of GSK's strategy is a Tres Canto Open Foundation, established in 2010. This open laboratory model fosters collaboration between GSK scientists and external researchers from around the world, allowing them to work together to discover new treatments for diseases prevalent in developing countries. Building on this model, in 2014, GSK's then CEO, Sir Andrew Whitty, announced strategic investments in sub-Saharan Africa. This included the creation of Africa's Non-Communicable Diseases Open Lab. With a commitment of up to £130 million over 5 years, GSK aimed to develop homegrown research capabilities and address specific healthcare needs in the African population. To understand what impact this initiative had locally, I spoke with a clinical professional. This is Dr. Arthur Kwizera. He's a Ugandan anesthesiologist and an interventionist who serves as a senior lecturer in anesthesiology and critical care at Makerere University College of Health and Sciences in Uganda.
GSK led the way in this at some point. The CEO was a gentleman called Watts. I actually met him. And they came up with an initiative to price for Africa. They had an understanding that, okay, in order for us to, because you innovate and develop a product, and when your patent runs out, hardly have you, as the patent ended, then suddenly there's stocks of all of the drugs from all different places of the world, but it compromises. Because typically what happens, if you look at ceftriaxone, people don't know, say, because people associate with the original, say, oh, Rocephin. Even though that brand of Rocephin is, oh, there's a famous drug in Kampala called Epicephin. But people associate it with it. So it comes back to the originator, the pharmaceutical sponsor. The pharmaceutical sponsor's drug is associated with mortality. Not the in-between, not the generic manufacturer. GSK decided, all right, they got whatever antibiotics and a bunch of 6, 7, 8 products, and they priced them for Africa. At some point, they even branded them different.
So, who is Dr. Arthur Kwizera mentioning? This is Sir Andrew Whitty. Former CEO of GSK, having been an employee for 32 years, he had led many initiatives. One of them was the strategic investment in Africa's non-communicable disease market. Like other pharmaceutical companies, GSK had faced competition from cheaper generic drugs in the region. GSK's key measure of profits and core earnings per share had declined in previous years. In order to combat this loss of market share, they decided a local drug presence was needed. The African Non-Communicable Disease Open Lab, centered at the GSK's R&D hub in the UK, collaborated with local African research institutes to conduct groundbreaking research on non-communicable diseases. The lab focused on understanding the unique genetic, environmental, and cultural factors influencing non-communicable diseases in Africa. By engaging with African researchers and leveraging GSK's expertise, the Open Lab aimed to generate new insights into disease mechanisms, developed tailored treatments, and improved healthcare outcomes. The majority of the research was planned to be conducted within Africa, ensuring that the local scientists were at the forefront of these efforts. A key component of this initiative was a robust R&D training program. By partnering with local academic groups and research centers within Africa, GSK was showing a commitment to building a new generation of African scientific leaders within non-communicable diseases research. What were the challenges faced for this initiative? While the project had many successes, it also faced substantial challenges, many exacerbated by the COVID-19 pandemic. The pandemic caused delays and disruptions. For instance, some projects experienced significant loss to follow-up and others faced significant delays in longitudinal data publication. The reliance on international labs for sample analysis led to delays as shipment samples often fell to the back of the queue during the pandemic. This highlighted the need for improved local laboratory capacity. Political unrest, strikes by healthcare workers, and procurement challenges also posed a significant hurdle. Despite these challenges, the African Non-Communicable Disease Open Lab had a profound impact. It demonstrated that the right infrastructure and support, African scientists could conduct high-quality research. The research led to enhanced scientific knowledge, improved skills, services, and directly benefited patient care locally. The personal development of principal investigators and their teams is likely to have a lasting benefit, enhancing future research and local healthcare. The decision to shut down the African Non-Communicable Disease Open Lab stems from the shift in focus towards sustainability and future research directions. GSK is now looking to support similar initiatives through new partnerships and collaborations. A new Open Lab initiative focusing on young career scientists working on infectious diseases is set to commence in 2024. While the closure of the African Non-Communicable Disease Open Lab marks the end of an important chapter, the legacy of its successes and the lessons learned will continue to influence and inspire future research and healthcare improvements across Africa. In the fight against non-communicable diseases, collaboration and innovation are key. GSK's initiatives in Africa exemplify the power of global partnerships to address local healthcare challenges. As we quickly approach the World Health Assembly's 2025 goal, we must remember the work has not yet ended. Bringing medicine equality to the region is just the start. Thank you so much for joining me, and I will hopefully see you in the next video.